so first of all, what I want to be able to explain is what is health insurance, or the whole system in general here in the United States. And basically what it is, it's a reasonable and affordable way for citizens to be able to afford any kind of medical problem that they need to go see the doctor. And basically what it covers, it should be able to cover drug coverage, mental health services, and inpatient and outpatient care, and even be able to coverage pregnancy or childbirth. And with the plan that Bernie's trying to implement, which is Medicare for all, it is a system where the national health system is responsible for the healthcare of all citizens. There would be no private hospitals or clinics. All healthcare are run by a single national health system, which means that as a citizen you won't be able to have a say where you should go, or like where you want to take your child to, which pediatric you would go. You would be someone from the government will give it to you. And personally, I don't think that would be a good idea, because that means there would be no competition at all in the medical field, and everything would be the same. Everything would be controlled by the government, and if you want to go to one of the best doctors, you won't be able to, because according to your plan that you have with the government, you have to go to a specific one. And being able to go to the one you would want to really benefits you yourself, because you are the only one that truly knows what's best for you. And then the government right now has a lot of plenty of resources that citizens can use if they do need help getting health insurance from the government. For example, the Affordable Care Act, which is the ACA, and which is a care act that the government has right now, that a lot of employees or jobs use to give it to their workers. And then it has actually helped the economy increase a lot, because people are buying it through there, and more people are getting health insurance. And also there's social security service, where the elderly are able to retire from working, and they'll be able to get a check every month and go to the doctor, and that check will cover any health problems they have. And then there's so many options. People just need to be able to look out and find the best healthcare system that they think would be affordable for them, and which healthcare provider they want to go to. And going into the plan of the Medicare for all would not be good, because it will mean that doctors will be paid low, and it can cost your freedom of voice as well, because you won't have a say in which doctor you want to go to. And the both patient and doctor ratios will go increase, because more people will be going to the same doctor, and there'll be no competition. And then right now in the US, we have a good healthcare program, where like the Texas Children and the medical center, they are very good. And then we need competition to be able to succeed more in our medical field. And the US right now is really good with that. We have one of the best doctors here in America, and patients should be able to choose what doctors and health insurance they want. It shouldn't be governed by the government.